Because of Victoria jogging, she's going to end up experiencing several cardiovascular changes, such as increased heart rate, increased cardiac input, and her blood vessels are going to end up going through vasculodilation. The reason for the increased heart rate is because the body needs more nutrients and oxygen to supply with all the workload. So the heart rate is going to increase in order to increase the blood flow to deliver more oxygen and nutrients to the body. This is done through the sympathetic nervous system. Blood vessels will end up going through vasodilation in order to allow a wider diameter to allow more blood to flow through at a higher volume. This is also controlled via the sympathetic nervous system within the autonomic nervous system. The blood vessels primarily targeted are the arterioles blood vessels. I firmly believe that her capillary sphincters within the quadriceps would end up becoming much more wider in order to help pump more blood through the muscles. The sphincters within her quadriceps would end up having to become much more dilated during this whole process in order to allow more blood flow to occur within the muscle, as well as to help deliver nutrients and to remove any waste from any of the muscle reactions. Her face is turning red because blood redistribution is occurring within the muscles to help transport blood to the top priority organs within the body, such as the heart, the lungs, and especially the skin. And with the blood flow increasing and going closer to the skin, it causes her to appear much more red, and that's what explains the phenomena. Blood redistribution is for when the blood is transported to the higher priority organs that require it during exercise. Higher priority ones include the brain, the heart, as well as both of the lungs. The ones that have lower priorities are things such as the kidneys and the digestive system. The heart is able to reach a higher rate as well as contract and with blood vessels dilating via the sympathetic nervous system due to the fact that it ends up releasing certain chemicals within the body, such as epinephrine, in order to help cause these reactions. Along with her heart rate, her respiratory rate would also increase because she would have to take in more oxygen. And with gas exchange, she would have to take much more rapid and much more shallow breaths than she did before. Her bronchial tree would end up increasing in diameter due to the smooth muscles that are within it to help make it dilate, going through bronchodilation. These smooth muscles are specifically located within the smaller bronchioles. The immediate effects from exercise could include a faster heart rate, a higher cardiovascular output, as well as flushing out any of the toxins via sweat that are within the body, such as waste. Long-term effects include a shorter resting heart rate, more cardiovascular health, as well as lowering the chance of cardiovascular disease in the long run. The mental effects that can occur are things such as decreased stress, which could also lead to decreased depression and anxiety within an individual, allowing them to become much more relaxed. The brachial artery, if you were to take your 2 digits, would end up being around this location of the neck on either the left or the right side. Your brachial artery, if you were to take your arm, would be in the crest of where the bicep and the triceps end up being if you were to put pressure on it and feel a pulse. The radial artery, if you were to go to your radialis, would end up being closer to the wrist by to where the radialis and the ulna would be. The femoral artery would be around this location, right around here. The popliteal artery would be around to the back of the knee or the back of the patella. The posterior tibial artery would be to where your ankle is, the bony protrusion, and it would be to the posterior side behind it to where the tibial is at its joint. And the dorsalis artery would be more akin to the top of your foot, in between some of the muscles.